Okay, just a really quick recording because I've had some clients ask. For most people, progesterone has a very calming effect, but you do see a very small percentage of patients where it gives them the exact opposite effect. They actually get wired up or more anxious from the use of progesterone. Now, the first question you always want to ask is that are you sure that they gave you actual progesterone? Because a lot of synthetic progestins can cause that effect. But even then, I would say that's the majority of the cases. But even then, there's still a small percentage that use bioidentical progesterone and they still get the opposite effect. They feel more wired. In those cases, so hopefully this records my mouse right here. Progesterone, which you can see here on the left, it actually can convert all the way in some cases to cortisol. And in some people, it can do that excessively. So they take progesterone and they end up getting excess cortisol, and they feel more anxious and revved up because of it. Now, one of the things here that I've seen, and I really honestly, I'm not a huge fan of these mechanism of action diagrams because I strongly feel that they oversimplify all the processes that can happen in the body. But just for the purpose of demonstration, I want to show that this enzyme here, this 11 beta hydroxylase, is one of the enzymes that's responsible for this conversion to cortisol. There are a lot of natural remedies and herbs. Two that come to mind that we use in the office all the time are licorice extract and ziziphus seed extract. And the reason I bring those ones up because I use those a lot in perimenopausal cases. Those can reduce that enzyme, reduce the excess production to cortisol, and I've seen that help for a lot of perimenopausal females. If you're struggling with this, feel free to look into it more or reach out, and I hope this was helpful.